We have 4 transfemoral patient follow-up scheduled. That's the plan anyway. So often I make a plan for the day and it ends up looking completely different, but that's the plan. And so for this first patient, I've shared part of his story with other videos that I'll link above and put in the description below if you want to go check those out. He has bilateral transfemoral amputations, was never given the chance for prosthetics, was definitely interested, and so proud of his progress. He has been doing an awesome job with physical therapy. So let's go check out how he's been doing the last couple weeks. So you remember me saying how things don't always go according to plan? Patient is actually in isolation with COVID. So be sending him your good thoughts, wishing him a quick, speedy recovery so we can touch base with him hopefully in a few weeks. Next stop is another skilled nursing facility. There's actually 2 patients in there. So example number 2 of things not going according to plan today. Was denied access into the building. Was hoping I would not have to address this or it be an issue, but was denied access into the facility because I'm unvaccinated and they are not accepting vaccination exemptions. And understand, I am not anti-vax, I'm not anti-vaccinations, but I do have my own personal reasons, medical reasons and otherwise, for not wanting to get the vaccine, which frankly is nobody's business. I am not okay with the arbitrary rules that are inconsistent and the manipulation that has brought me to this place of not being able to care for my patients unless I get a vaccination that I don't believe is necessary or healthy for me to get. On our way to see patient number 3, he has a right transfemoral amputation. He's had his prosthesis for probably about a year now, and for the most part has been doing really well. But he did have a recent back injury that kind of set him back a little bit, so we'll check in and see how he's doing. Hopefully we won't completely strike out today. Patient stated he had been using the prosthesis more and was doing well with it, and then they've had a couple people in the hall have COVID, and so he hasn't been comfortable going outside or walking in the hallway, so did not work with him and the prosthesis today, but hopefully we'll call back in a couple weeks, things will be calmed down and he'll be up to doing a little bit of work with us in the prosthesis. Definitely an interesting day. So this patient, she has a left transfemoral amputation, and she does have some wounds on the right medial ankle and a couple wounds along her shin on the right side. She's been having some swelling and pain on that side and skin opening up, and today they looked a lot better, but she also fell out of bed a couple nights ago and injured her femur on her amputated side. She mentioned it would just be really nice to have, if someone can go with her to the appointments, who can just kind of help explain things to her. And even while I was there, just being able to, because she was just really overwhelmed. She feels like she has no idea what's going on. And so just being able to kind of sit down and explain to her simply that, well, you know, going to the cardiologist to see if it's a possibility to reestablish that blood flow in that right side because of the blood clots that you have in that leg, and see if we can help reduce some of that swelling and help those heal faster. and improve the health in that limb. So trying to figure out where her appointments are and when her appointments are, and see if I can possibly meet her at one of those appointments, especially her vascular appointments, if they're talking about health of that limb and saving that limb and preventing amputation. Yeah, like I said, interesting day. We had 4 above knee patients scheduled and did not touch a single prosthesis. Showing up matters, showing you that you care matters. And so just challenge you guys to, at some point during the next week, find a moment where you can just go a little above and beyond and just show someone that they matter and that you care. And it doesn't have to be big. It can be as simple as opening a door or offering a compliment. So let me know about those moments below, and you guys take care.